well, lens replacement surgery is a procedure where we take out your own human lens and replace it with an artificial lens. We can use the artificial lens to correct only distance vision or distance, intermediate and near vision, and also correct any astigmatism that you may have. The science behind it is fascinating. So first of all, we have to then measure your eye in a process called biometry, where we measure the shape and the length of the eye, and with the use of various sophisticated formula, we derive a lens power. Then depending on your needs, we can use either a standard single vision lens for just distance vision correction, or just near vision correction, or a combination of both. Or we can use what we call a premium lens, where it corrects distance, intermediate and near vision concurrently.